Hello, I hope you all are doing great. So today the video is about ovarian cancers. So we will start off by talking about the risk factors for the ovarian cancer. The risk factors for ovarian cancer include a mnemonic fat single woman who smokes. So the first risk factor is obesity. Then second risk factor single stands for nulliparity, endometriosis, and intrauterine device, and smokes stands for smoking. The incidence for the ovarian cancer in general population is around 1.4%. This comes sometimes in MCQs, and then the mean age for the ovarian cancer is 64 years. Sometimes the presenting complaint is ovarian torsion. If there is ovarian torsion, then we can suspect the ovarian cancer if there are risk factors present. So next we will talk about the types of the ovarian cancer. So there are three types: epithelial, sex cord, and germ cells. So epithelial, the mnemonic is same cell. Epithelia are the same cell which we read everywhere in the body. So the mnemonic is same. So same, S stands for serous, M stands for mucinous, E stands for endometrioid, and cell stands for clear cell. So about the serous, it is the high and low grade, and the high grade is most common, and it has samoma bodies. So serous S and samoma S. So we say that the serous has samoma bodies, and the antigen for it is CA125. Next is mucinous cell, and mucinous cell is mainly with appendicular mass or with pseudomyxoma peritoni, and the marker for this one is CA199. Next is endometrioid. It is not that important, and next is clear cell, and it is like renal cancer, renal clear cell carcinoma, and may arise from endometriosis. Next are sex cord tumors, and the mnemonic for them is that they all have L and G's in their name, and they are mainly there are symptoms of hormonal imbalance. So the granulosa cells has G and L in its name, so it secretes the antigen inhibin. So marker for this one is inhibin, and it has symptoms of irregular menstrual bleed, precocious puberty, and postmenopausal bleed. There is large abdominal bleeding mass sometimes is the presenting complaint. Next is Sertoli Redick cell, and it again has L and G in the name, and the symptoms are of virilization. So patient presents with amenorrhea, deep voice, and hirsutism. Rarely they secrete renin and can cause hypertension. Next is gandroblastoma, and it again has G and L in its name. So the mnemonic is G and L, and important thing about granulosa cell is that it secretes inhibin. So next is the germ cells, and for that we have mnemonic dirty. So for the D, we have dysgerminoma, and it is 20% bilateral, and it secretes HCG. And next is choriocarcinoma. So R we took for it choriocarcinoma R. So it also secretes HCG, and non-gestational is uncommon type of choriocarcinoma. It is mainly associated with molar pregnancy. Next is teratoma. It is mature and immature, and it secretes AFP. So it can transform to squamous cell carcinoma, and immature type is malignant type, and it has solid component more than fat component. Next is yolk sac tumor, and it is also called endodermal sinus. It can present with torsion or rupture, and AFP is also positive in this one. So you can see dirty. So the mnemonic D, dysgerminoma, and R, choriocarcinoma, as germs are dirty. So D, dysgerminoma, and R, choriocarcinoma, first two letters secrete HCG, and T, teratoma, and Y, yolk sac tumor, secrete AFP. So next are the treatments. So about epithelial cells, the treatment and diagnosis is mostly surgery, and the treatment option is total abdominal hysterectomy or plus bilateral salpingo-oophorectomy. So basically, total abdominal hysterectomy and bilateral salpingo-oophorectomy is the treatment of choice in most cases. But if there is omenectomy required or platinum-based chemotherapy required, then it is given. Similarly, for sex cord tumor, there is unilateral salpingo-oophorectomy, and it mainly depends upon the condition or the grading of the tumor. Next, for germ cell, again, there is surgery and lymph node dissection, and the chemotherapy for teratomas is BEP, bleomycin, etoposide, and cisplatin. Next, if woman is BRCA positive and completed the family total prophylactic bilateral salpingo-oophorectomy is performed on that woman. So basically, in salpingo-oophorectomy, as you talked earlier, there is salpingo start which states the fallopian tube oophorectomy is for ovary and removal of fallopian tubes and ovaries. Next are investigation. Transvaginal ultrasound is investigation of choice. CA125, as we talked about, serous. It is the most serious, is the most serious type of tumor. So we can remember CA125 by drawing two along with five like this, and then draw ovaries over here. So as I've drawn, you can see MRI is for the staging. MRI and CT both are for staging, where CT is extra pelvic and MRI is for the pelvis. Ascites patient, we can get the fluid cytological assessment. Follow-up patients, we need CA 125 levels. Next is FIGO staging. So the mnemonic for FIGO staging is outperform. So basically, outperform is the words. So O is for ovaries, UT is for uterus or tubes, or if you can remember this word P over here, outperform. So pelvis is mainly in the second stage, and pearl form PER is for peritoneum, and we have put L here, so we have lymph nodes here. So when we will talk about the staging, first stage is for O. So O is 1A is one ovary, 1B is both ovaries, and 1C is external tumor on either 1A or 1B. So this is how you remember this. Or 1C has C in it, so it can also have ascites. Now second is for the pelvis. We have taken the mnemonic UT here. So 2A is uterus, as we can see UT, uterus, or TU, tubes. 2B is any other pelvic organ. So I'll tell you to remember the word P in between if you can. It has other pelvic organ, and 2C is again same as 1C, but it can have other 1A or 2A or 2B stages in it. Next is Pearl form. So Pearl form, about PER we have peritoneum. So microscopic implants is 3A in peritoneum, 3B is implants less than 2 centimeter, and 3C is abdominal peritoneal plants greater than 2 centimeter or positive lymph nodes. So that's why we have put L in between Pearl form. And 4 is distant metastasis. If there is any problem, you can write in comments. Please don't forget to subscribe and like.